Hello,
Hi.
everybody
Hello,
here?
here we are.
Okay, so we're just going to give it a couple minutes to wait for some people to join us. We started the broadcast just a few minutes late, but we will just kind of chat for just a minute and see if we can get some people to join us. So maybe we'll make a short summary of what today's video or interview with Fran is going to be about. Um, Fran is a friend of mine. She is amazing, and I had the pleasure of meeting her for the first time over the summer at Smiles at Sea in July, and it was at the Cancun resort, and it was amazing. And she was a speaker there, did an amazing job. But before I even met her in person, we had connected online, and I knew that we had a connection. And so I was so fortunate to be able to meet her and to hear her speak and just connect with her in real life. And after the resort trip, we have been connecting through Facebook again. So she's been very active in some of the groups that we're in, Trapped in a Knot, and she has an amazing story to tell. So she has an amazing personal story that she might share some of that with us, and then also a really cool professional story. So
We're really
we
happy to have
have,
you.
yes,
Well,
thank you. Thank you.
I'm humbled and honored to be here, really. It's like, who am I? I mean, you guys are awesome. And I'm being asked to be on your show now. So I really appreciate
No, I mean, I have like, I wish you could see, I have goosebumps because you mean so much to me.
it.
And
Oh,
it's like, this is our first interview, and it means a lot that you have accepted and have trusted us to do this correctly. And
yeah.
I just appreciate the friendship in addition. So,
Well, that's it. This is three friends talking.
yeah.
It's the easy thing for me to do. And then, I'm humbled and honored. And, you guys are doing an amazing job. You've created something and you're going to be able to spread information to so many other hygienists so easily. So you guys need a lot of accolades, never mind me. So thank you for what you're doing
You're so
for,
humble.
for other
That's why you're
hygienists,
amazing.
being able to get together. So it's awesome.
Thank you.
So
Well,
what we plan on doing, oh, go
we've
ahead,
got a
Katrina.
few people. I just wanted to say hi to a few people that have jumped on.
Hmm.
Yay.
So what were you going to say, Sarah? Sorry.
Oh, no, it's okay. I was just going to say that we might maybe start with the introduction of Fran. And if maybe you'll just, Fran, if you'll just want to tell us a little bit about yourself. And then maybe the next thing we'll do is towards the end, we will open it up to a question and answer session. So if anybody has any questions for Fran, maybe she can answer those for us. How does that sound?
Sure. Um, well, I am a hygienist. I've been one for almost 35 years. I know I don't look it. Yeah, okay.
You don't?
But
You don't.
but no, I feel like I've only been practicing for 3. I just absolutely adore it. There's so many aspects about hygiene that I love, and it's funny how I got introduced right out of school to a certain type of dentistry, which a lot of people don't understand, but I actually fell in love with, and that is biological dentistry, also known as holistic dentistry, which there's a lot of misconceptions of what that is. But long story short, I worked many years in conventional offices. I worked for several different periodontists, all being professors at the university, one being a postgraduate professor. And periodontics was my love. I always wanted to be a periodontist. Always wanted to go back to school because that was just something that I loved. But life happens, marriage, kids, you're like, okay, by the time I get my license, I'll be 90. So, I decided not to do that. But I always had this love for wanting to treat perio. And that being said, when I first started being a hygienist, I was introduced to using phase contrast microscope. And it just changed my outlook on everything. So that was my first year of practice back in 1984. Years later, as time went on, working in conventional offices, I was always so frustrated with working on these perio patients along with these with the periodontists. I'm like, no matter what we do, we're just not getting any results. I'm seeing a lot of refractory perio and unresolved perio, and we're blaming the patient. They're not doing their home care. They're not doing this and that. But, I just didn't feel that that was the answer. So long story short, a couple of years ago, I was able to get into a biological practice, which means a holistic practice. And as soon as I walked in, I saw that phase contrast microscope. I said, I don't care what I have to do. I'm working here because I know what that can do. I mean, and I'll explain to you a little bit later if you're interested. I have to tell you, I feel so empowered that I know I can help my patients because I'm having them find why, not just treating symptoms. I'm treating the root cause of their symptoms. So that's my long story short, long, why I'm practicing as long as I am, because I now feel I can truly help people get well.
That's amazing. So so you're still practicing then? So how many days a week are you practicing?
Well, right now it's about a half a day on a Friday and sometimes on a Saturday, because I do want to keep my hands in. I don't want to be completely out of the op, even though I mostly am out of the op. I want to be in touch with my patients because I want to be able to see what's going on in the real world. I don't want to just read studies and all that. I want to see, how we change protocols in our office and we improve our protocols. And I want to be able to see the results because I'm part of an organization where we're always looking to improve how we're helping our patients get better through natural products and such. So I don't want my hands to be out, of the patient's mouth completely. So that would be a full day, if you want to say that.
So then trying to elaborate a little bit on what else you're doing, because you have your hands in a lot of things.
Okay,
You're
yeah,
a busy
like
woman.
what do they say? Jack of all trades, a master of none. I like to say a master of one. All right, master of hygiene. But I'm actually also a PR coordinator. I go to practices like naturopaths, acupuncturists, integrative physicians, functional medicine. I go to a lot of other offices and I have them. I want to be able to work with them because a lot of our patients that we get in our particular office, that it's a holistic biological office, a lot of our patients are very sick. A lot of them come very ill because they can't find answers of why they are not well. So we work collaboratively with a lot of these other doctors. So I go out and I am able to get these doctors to participate in working with us to get our patients well as a whole. Because that's what the word holistic means. If you go to the dictionary, holistic is not that I don't shave my legs and I burn incense. It's holistic means whole. It means treating the body as a whole. So that's why working collaboratively is so important with a lot of these patients who are very ill. So I do that. I am also not so much anymore because I have a different hat now. I was a social media coordinator in this particular practice also, and I was vacillating back and forth whether I should take this position. Was that I became the qualitative director of this particular office, the multi-million-dollar practice, and I have 3 divisions under me, so I am now able to be, in long story, quality control. I am quality control, which makes me so happy because quality control, that means I'm going to be able to really help my patients because I'm overseeing all the details of how they're treated and treated correctly and fairly, and that they're getting well. And lastly, I've also started my own company, Integrative Perio Solutions, LLC, which I am putting on a little bit of a hold right now because of some health concerns, which I may talk about later. So I'm a little bit on hold with that. I did have already my first clients where I'm actually helping conventional offices flip into potentially using some of these biological protocols because today the millennial market is looking for this type of treatment to the tune of about $33 billion a year. Some say even $60 billion a year. So for us to not recognize the fact that people are searching out this type of modalities and just ignoring it and saying, okay, I was taught this, and this is what I'm going to do. yeah, there's a lot of good, valid reasons why you should do that, but you need to open and broaden your perspective, because there's a lot of patients that are looking for help, and if you don't have the tools to help them, how can you help them? You know, so a lot of conventional offices are actually contacting me through whether it be LinkedIn or Facebook, private message, asking for some information on that, because it is a market it's increasing.
Absolutely. Do you feel that, what do you think the percentage is really? I know it's probably hard to say that offices are more patients are kind of leaning towards
Well,
holistic
if you, I don't have a percentage per se because I haven't done that research yet. I don't have the statistics, but I know there's a lot of misconceptions about what holistic. I like to call it biological dentistry because that's really what it is. I like to, it is holistic because it's as a whole, but there's a misconception of what it is because they think it's, like I said before, just incense and, we're using quackery and stuff, but it's all evidence-based science. I refuse. I come from if I don't see that it works, I'm not going to back it. I want to see the science. I want to see the papers. I want to see the research. And clinically, I want to see it work on my patient. And if it's not working, it's a bunch of hooey. It's a bunch of crap. Excuse me. It's not. I won't use it. So I will only use evidence-based, science-based modalities, and I see that it does work now. As far as a lot of the offices, they hear the word holistic, then they're very turned off because they're like, ah. But there are some that are finally realizing because they see on all the social media and in general, there's so many patients, and I hear a lot of on some of the forums, officers complaining, yeah, I had a granola mom come in who, doesn't want their kid to have fluoride, doesn't want them to have x-rays and all that stuff. True, it's becoming more and more apparent. There are alternatives. There's things that we can do. Okay, I still use fluoride toothpaste myself. Okay, I'm not one of those, okay, all or none. No, I believe in, you have to be reasonable. Okay, you have to be reasonable. So, but if somebody who's looking for treatment, you're going to turn that patient away, the patient's looking for help. So never mind that patient's not getting help. And what happens to your bottom line? More and more of these patients are looking for alternatives, and maybe, you need to stay relevant because otherwise, your practice is going to start to dwindle. You start getting those holes in your practice because they're going to find somebody who's going to give them what they want. Today, everybody goes on Google, Dr. Google. Everybody wants to find out. They find out all this information. Patients coming in very, very learned, very, very educated and savvy. Unlike years ago, they came in, they sat in the chair, and whatever you told them, they're like, okay. Now they're giving you pushback. So now you have to step up your game. You need to be able to have those answers and be able to offer them things that that you believe, again, evidence-based, science-based, that you believe you can offer that will kind of segue into this new, it's not really new, but this new wave of thinking these people are looking for, this type of dentistry, which is conventional dentistry, actually.
Mm-hmm.
So tell us, Fran, really, what was your journey to getting into holistic dentistry? Why is it your passion? Why do you love it so much?
I love it because, like I said to you off, camera, it is my why. I look, I see the reason why. I'm not just looking at a situation as it is. I'll give you an example. I have a patient who has tissues inflamed, erythroedematous, bleeding, purulent, 5-6 millimeter pockets. We do the scaling and planing. They come back and they still not, I'm sorry, the tissue still looks like heck, still bleeding. There's, no matter, and then now all of a sudden I'm going to say, oh, well, you're not doing your home care, but in actuality they are. Yeah, I got to find the why. I'm not just going to keep that patient on it every 3 months. So the fact that I can use a phase contrast microscope, I can find out why. Mm-hmm. What I do is I take a sample of that subgingival flora and I get it on a microscopic slide and I put it under the phase contrast microscope. Phase contrast it refracts the light. So what is light is now dark and what's dark is now light. It's almost like a negative. So I now can see the pathogens such as amoeba, spirochetes, gliding rods, trichomonad. Trichomonad and amoeba are parasites. I can see a plethora of white blood cells. If I see all these white blood cells, that means the body's fighting an infection, right? So I'm going to keep looking to see why the body has so many white blood cells in that pocket. So now, if I scale and reclaim the patient and I have them just keep coming back every 3 months, if I'm not using a microscope, I can't see the why. So that's why I feel so passionate about it, because now I can treat the cause. I treat the why. I don't treat just the symptoms. The symptoms is the bone. Okay, and I'm getting too passionate here. Okay, I'm not just treating the bone destruction. I'm not just treating the gingival inflammation. I'm not just treating the purulence and the. I am treating the why. I'm going to give you another example. Okay, I'm sorry. I'm just going to keep talking, and it's crazy.
Oh, we love it.
You're probably going to regret having me on here.
No,
This is
never.
a very true story, which I was telling you guys earlier, and I'm going to have your audience listen to this. Tomorrow, I am actually have to be at the hospital at 8 o'clock. I'm having surgery. I am having parathyroid surgery. And you say, wow, why? Back in April, I remember the day, April 22nd of this year, I slipped on some stairs and I fell. I had a non-displaced fracture of my fibula. It's a non-weight-bearing bone. It's a very simple fracture. It was non-displaced, easy peasy. All right, they put me in a boot. No big deal. Wore the boot. After the 6 weeks, I took the boot off per the doctor's instructions. No problem. After about 3 weeks, every day the pain was getting worse and worse and worse and worse, to the point where I was literally, not even a joke, crying and yelping in pain. And I can take pain. I'm like, testa dura, the hard-headed Italian. Couldn't take the pain, so I figured my rheumatoid arthritis was acting up, because I do have RA. So I go to my rheumatologist thinking I need a Medrol dose back. Again, I'm reasonable. I'm going to need some cortisone. Okay. So I go to the doctor, and he's like, Fran, I've never seen you cry like this. There's something wrong. Let me take an x-ray of that ankle. The x-ray tech comes running into the room and says, did you know you broke your ankle? I said, yeah, 2 months ago. And they're like, no, it's broken now. It looks like you broke it now. And I'm like, no, that was 2 months ago. Long story short, the ankle wasn't healing. I had no healing whatsoever. So now I'm like, great, wow, I'm going to Cancun in a week. As Sarah knows, we met in Cancun. I was a speaker there. I'm like, what am I going to do? So I quick get back in the boot. They send me to another orthopedist, a different guy. He takes a look at the x-ray and he goes, yep, you're going to need surgery. We need to put a rod and screws in that ankle. And I'm like, okay, I'm leaving for Cancun. We'll think about it. And in my mind, I'm like, no, we are not doing surgery for that. I want to find out why it's not healing. Just putting a rod and screws in there, that's just fixing the symptoms. Why is it not healing? Long story short, they checked my blood work. When I came back, I went to another doctor. It was like, go to this one, that one, this one, this one. The calcium was high. He sent me for a parathyroid test to see if my parathyroid hormone was up. Sure enough, the hormone was high, which means the parathyroid hormone regulates your calcium. So it was leaching the calcium from my bones. So not only was it leaching the healing bone, leaching the calcium, I now have early osteopenia. So now I'm having the surgery to remove the adenoma on my parathyroid. So I am having surgery, but I'm having the correct surgery. I'm fixing the why, not the symptom. Okay? Mm-hmm. So I'm getting a little passionate, but this is exactly why I love what I do with holistic dentistry, because we're treating the root cause of disease, not just the disease in and of itself. We're treating the why, not just the what. Okay?
Yes.
So there you have it.
Wow. Well.
And what I love about what you're sharing is all too often we treat everybody the same, but right. I love that you're taking the extra steps to identify their certain bacteria that's in their mouths and treating it individually. I think that's really important, because all too often we get caught up in time and, how much time do we have left, and go. And I love that you're taking an individualized treatment approach to every single person and giving them the best that's the best for them. Which is awesome.
That is so true, and I'm going to tell you why. You're giving me goosebumps now saying that. I had a patient 2 or 3 days ago. I think it was actually on Saturday. It was a new patient. She's trying to get pregnant. Young girl, this and that. They already has a 15-month-old baby. And she is, she works out like crazy. She takes great care of her body and this and that, because I'm here because I'm trying to get pregnant. I want to make sure I have no problems in my mouth. I want to make sure everything is healthy and good because, I want my body to be clean, for when I get pregnant. That's a perfect idea, because she knew about the connection of gingivitis and early term birth. So I take a slide, not expecting much of anything on her, because her pockets were all 1s, 2s, and 3s. Gingival tissue. The tone was great. She had never. I wouldn't even say any bleeding. I can't remember. I don't even think she had scant bleeding. I mean, her home care was good. Not a big deal. So take the slide, put it on the side, let it sit for about 10 minutes, and then we go and we look at the slide. And I'm looking, and I see a lot of good cocci, which is a good healthy bacteria. I said, this is what I expected. And then I saw a big bunch of white blood cells. I'm like, okay, there's a reason why there's white blood cells. And I tell her, there is too many white blood cells. I want to keep looking. Sure enough, I kept looking and looking and looking. And amongst those cocci, there it was, a big, juicy amoeba. That amoeba was in her mouth. And even though her pockets were perfect and her tissue was pink and her mouth was healthy, she had an amoeba. So I was so excited. She was so grossed out. But I'm like, it's a good day. It is. If you ever see amoeba on the slide, you're like, oh my God, get that out of my mouth, please. But it said, this is a good day because we found it. I can get rid of that. I can tell you how we can get rid of it, because if we don't get rid of it, guess what? In 6 months, a year, whatever, you're going to start to have problems. We get rid of it before it causes a problem. So we're taking individualized care, and we're prevention specialists. And this is like the ultimate in prevention, as far as I'm concerned, prevention specialist. I'm not treating disease. I'm preventing. Now I've just prevented her from having disease. So that's why I'm so passionate about everybody should be on board and using this type of modality.
Yeah. Well, Fran, do you care if I ask you maybe a couple specifics? Like, I know I don't really know a lot about this, so I'm sorry, common knowledge out there. But how do you get the sample? How do we do that? What's the first step? If you could walk us through the steps.
What I do is I will have my patient make sure they don't rinse or anything. Well, first I do is I'll take a sample of their pH. I have pH paper. I check the pH and see if they're acidic, alkaline, because the more acidic the mouth is, the more apt they're going to have gram-negative pathogens in there. So I check the pH. Then I take my curette. Either I take a Gracie or Columbia, and I go subgingivally. I do not take supragingival plaque. A lot of people say, "Oh, take a sample of your plaque." Supragingival plaque, that's all gram-positive. That's going to be put it on the slide, and it's going to be fine. I don't care about the plaque. I care about what's going on underneath in the subgingival flora. So I go subgingivally. Depending if the tissue is tight, I'll take a thin Columbia, Gracie, and then I'll go in and get a sample. I try to take it from at least 4 sites, usually from the posterior and the linguals, because that's where a lot of patients can't get to. So I try to get the sites where it's hardest for the patients to reach. Or if I have a Perio patient, I will make sure if I see their x-rays and I'm looking at their charting, I make sure I use a long shank and I try to get as subgingivally as I can comfortably for the patient to try to get something as deep as I can. And then I put it on the slide, and the medium that I put it in is specifically manufactured to have the pH balance of saliva, because you cannot put it in a saline solution, because the saline solution will kill the live bacteria. You want to see it living. You don't want to see it dead. You want to see it alive. So you put it in that saline solution, and then you put your glass cover on. Then you seal it, because oxygen can kill the bacteria, because these gram negatives are anaerobic. So you have to seal the edges so that no oxygen can get in there, because again, you want a live sample. And then I let it sit for about 10 minutes, because now my room is about 70 degrees, but the body is about 98.6 degrees. So now if I put that living bacteria on according to them, a cold slide, they're going to start to slow down. Their activity is going to slow. I want to see them as active as possible. So I let it sit 10 minutes so everything gets to, a balanced temperature. Then I bring it to the microscope. So it's as simple as that. Taking the sample, maybe tops for a minute. tops a minute. Because I've been doing it for so long, I can do it in less than that. Because I take one side, I flip my instrument, take the other side, put it on the slide, and then then I go on the maxilla and I take one sample, flip my instrument, take the other sample, and put it on the slide. It's fairly simple after a period of time, but it gives you so much information, and if nothing else, it motivates the heck out of your patient. Once they see that stuff flying around and running around, they are like, oh my God, how do I get rid of that? That's nasty. So, and they're very motivated. So a lot of times you struggle to get your patients motivated to do their home care, their water picking, their brushing, their anything that'll motivate them. Sarah saw some of the slides in Cancun. Yeah,
Yeah,
gross.
it was awesome.
Kind of gross. So, I get used to it now.
That's all we're all trying to do is just motivate and get everybody healthy. So if that's a visual for somebody, and that's okay.
Yes, and because I can explain till the cows come home. Yeah, you see how your bone loss is here, and you see all these numbers, and they go, they don't know what that means. They don't know how to read X-rays. Show them what's real. Those living bugs running around, that's real. And they're gonna be like, okay, yeah, I don't want that in my mouth. I'm gonna get rid of it. So it's a win-win. Patients win because they get to embrace and own their disease, and then we win because now we're going to be able to not only cure the disease, but hopefully arrest it and find the cause, so that way it won't happen again.
So let me ask you a quick question. If you had to pick only one home care product for your patients, which besides a toothbrush and floss, what would it be?
Hands down, a water pick. Water pick, water pick, water pick. Did I say water pick? Oh my God.
I don't think so.
When I was back in school, back in the ancient times, I started back in 1980 and I graduated in 84. They said, don't use a water pick. It doesn't do anything. It just pushes food around. So for years, I didn't recommend a water pick. Said, nope, not going to work. And then I saw the studies come out of University of Southern California where they used electron microscopy, where it showed that it did work. So I said, okay, I'm going to do my own test. So I selected some patients and who had inflammation, etc. And no matter what we did, we could not get them healthy. I had them use the water pick, and then I checked their PSR, and I did the whole PHP thing, and I had them back in 3 months, and I checked them again. Hands down, the improvement was beyond a shadow of a doubt. Amazing. So not only did I look at the research, like I said earlier, it has to be science-based. I saw the research, and then I did my own little unclinical study, and I said, that's it. It works beautifully. Now, I can make a suggestion. I do not suggest that everybody do this until they do a lot of their own research, please. But a lot of my patients who I find on my microscope, if they have a lot of spirochetes, despite all of the work that we've done, we've had them on certain natural antibiotics, et cetera, et cetera. Somebody just asked before, what do we use? We use a lot of natural antibiotics, kind of like colloidal silver and things with like oregano oil and all that, oregano and onion, garlic, and changing the pH balance of the mouth. But using melaleuca and oregano oil. Melaleuca, the tea tree oil, the tea tree helps break down the lipid layer of the bacterium with the fatty layer, and the oregano can kill them. So a lot of times these patients that have residual spirochetes, I will have them put a couple drops of the tea tree and the oregano oil in their water with the water pick, and it really does help. Because we can't keep just putting them on antibiotics all the time. So anyway, that's.
This is right up my alley, Fran. I love this kind of stuff because my youngest child is 5, and she's a finger sucker, and she has gotten hand, foot, and mouth 4 times.
Wow.
There's nothing that they can do for that. And so I think it was the 3rd time I was like, all right, so I have to figure something out. And I did my hippie research. I can call myself that. and I ended up making her bone broth with garlic and cloves. And I am talking about within 2 minutes of her having her first sip, she was able to start drinking. It soothed her mouth so well
Well,
that I
that's
was
it.
sold after that.
Well, that's it. See, there's a
Mhm.
lot of, again, I'm an old dinosaur, so I've been on both sides of the aisle, and I still believe in a lot of the conventional stuff. I mean, that's how I was trained, and I still, what works, it works. But there are so many other alternatives that do work. I mean, just think about it. Penicillin. How did they found penicillin? It was made out of mold, right?
Right.
Right. So it turns out that there's a lot of natural things that do work, but we're so you know brainwashed. Well, I would say brainwashed. We're so like doing the chemical thing that we don't want to see that there are natural things like boom, like garlic, things. Cloves. That's what you use and all, right?
Right.
So
Right.
um, there's so many things that can really, really be very, very beneficial. So there's nothing wrong, and it's not being hippie. It's about trying to be safe, trying to help your child without putting toxic junk in her body, because there's an
Yeah.
accumulation of between the air. I live in New Jersey, so you can imagine all the junk in the air here, the water, the air. My body's full of toxins and stuff. So the less I can, purposely put in, I'm gonna. I mean, even now, I feel like this is Guna flu. I've been taking it for the past few days because I feel like I'm just on the edge of getting cold, and I have surgery tomorrow, so I can't get
Yeah.
sick. So I've been eating this homeopathy for the past few days, which are little pellets of homeopathy, and I have not gotten sick yet. I just, you just start to feel it. That's how I feel for the past few days. If I didn't take it, I know I would have been like this, sniveling and all that stuff, and I would have had to cancel my surgery. So it's definitely like, yes, Jessica, it's blending both, best of both worlds. The
Mhm.
technology and using natural products. There's nothing wrong with that about helping people.
Now, I know Sarah said uh, we are going to get cut off soon, and
Yes,
I can't see a time, Sarah. I can't see a timer, so
I can't
that's all.
either.
we have
Okay.
4 minutes.
Oh, okay.
My
Well,
clock says 8:36.
um,
Okay.
if somebody wanted to go and find about info about all of this, where would you send them?
Actually, my website's not up, but you can actually. There's information at the IAUMT.org, International Academy of Oral Medicine and Toxicology.org, or the IABDM.org. It's International Academy of Biological Dentistry and Medicine, or the HDA, the Holistic Dental Association. I'm actually speaking at the International Academy of Oral Medicine and Toxicology in Denver in March. So IABDM is great, HDA is great. I have a little, you know, I happen to be a little partial to the IAUMT because I feel it's very science based. You'll see a
Okay,
lot of scientific research on their page, so that's why I like that.
thank you. Well,
Or you can contact me, PM me. That's okay. If it's okay with Sarah, you,
Oh, for
Katrina. You go through
uh,
you guys, so you can always ask
no,
questions
you're
on the
very
page.
open, and I've messaged you, and
Yes,
you're very sweet, and anybody, yeah, feel free to reach out to
that's no
Fran. She's
problem. Yeah.
awesome. She's not scary. You can reach out,
Yep.
find a
Yep.
mentor. Um,
Absolutely.
we did promise that we were going to open it up to Q&A, and I can't see any messages either, Sarah and Fran. So I know we don't have long, but maybe if there's a question somebody has.
And somebody just said something about the tooth and gum tonic. Yes, I love it. Love it. It is works really, really well. And actually, if you go on their website, they have stuff that you can put in their patients can put in the water pick also. So the tooth and gum tonic stuff patients can use at home, and you can use it also in your office. Stuff is
And I
great.
think, Sarah, let's try and make a post
Okay.
on a couple of things that Fran's recommending, so maybe some people can follow up on these. We'll
Yeah.
do that afterwards.
Okay. I'm just trying to confirm our time limit here, so I'm just going to be looking away for just a second. Katrina, if you want to take over while I research this a little bit.
Okay. So, Fran, I think that you're awesome. You're
Yeah.
fantastic. You're such an inspiration. I would like to know where you see yourself a year from now.
A year from now, I'm speaking with the IAMT in March. I hope to be still speaking with them by that time. Uh, I also have been approached by someone else who's very well known uh, in the field, and she may want me to be speaker for one of her for her for her company that gives seminars. So I see myself doing a lot more speaking. My boss gives me full. I already told him. I said I'm only going to take this position, this qualitative director position, if I can still do my speaking engagements. He said that brings you joy, then you should go for it. So,
you are lucky. You are a
yeah,
blessed
I am. I have to say, I am very blessed. I adore him. Dr. Vladimir Grushinsky, I love you. He actually re-energized my love for holistic dentistry. He's by far one of the most beautiful human beings I've ever met. Him and his wife are good people. So, yeah, I see myself hopefully speaking more, not for personal benefit. I want to be able to share my knowledge because that way people can help more people in this way. That's why.
Absolutely. Now, here at the Moeller Report, we're very passionate about people going after their dreams and creating their ideal life. What advice would you give somebody who has a passion, but they're not really sure how to go about getting it and creating it?
Whatever their passion is, and again, finding their why. A lot of us know Jamie Freitag, finding your why. And once you have that why, you find what fuels you. Find a way to follow it. Because here I am. There was a point where it was just scaling one patient after another. I'm just scraping, and my passion for what I do is re-energized since now I'm back in practicing holistic dentistry. Find your why and then try to make it happen, even if it's only a little bit each day or a little bit each week. Even if it doesn't happen overnight, just don't give up on it. If you give up on it, you're never going to have that fulfilled feeling. This is the first time in my life at 55 I truly feel fulfilled, engaged, and I feel like I have all aspects of my life in order. Like I feel very good because I'm able to do what I love. It's not about it's not a job anymore. Even if your passion's not doing hygiene anymore, then go do that. My brother was a physicist. He was teaching physics at NYU, and he said, I hate this. Hate it. He was a musician. So what did he do? He walked away, and he became a musician. He now lives on Maui, and he blows a saxophone.
That's amazing. I love that.
Gave up this thing that he thought he had to do. He didn't follow his why. Now he does. So anybody who finds that passion, just don't give up on it. Just chip away. Talk to mentors, talk to people, connect with people who could potentially help you and find, I didn't think of that. I could use it in that way. Just don't give up on it.
Fran, do you feel like you always had that path? Did you ever feel like you were confused or lost or didn't know which direction to go?
Oh, sure. Absolutely. Absolutely.
Okay.
Yeah, I felt like I'm doomed to scale teeth for the rest of my life till the day I die or the day they pull me out of the op on a gurney. I felt like because I was in a conventional practice and it was so stressful because all the drama and all the administrative nonsense, and I'm like, this is why I'm doing. No, this is not. I said I really got to find something else, and that's why last July is when I had the aha moment that I'm like, okay, I got to find what I need to do. I got to find my passion. And that's when I'm like, why don't I just do what I do, teach other people to do what I do? And that was it. So it was just like, I got sick and tired of just scraping crap off people's teeth. Pardon me for being blunt. But I think we all feel that way sometimes, that we feel like we're just scraping crap off people's teeth and we don't have a purpose. And now, even though I do it, I feel like I have a purpose now. There's a purpose to it.
Yeah.
So, because I'm doing it the way I love to do it, not the way I had to do it. So.
Amen to that.
So,
I do have a little update. We can go live up to 4 hours, just so you know. I don't know.
That's all you had to tell me. Okay.
So we're good. We're good.
I do have to get ready for my surgery tomorrow. I ate up. See, I told you. I said, don't give me. I said, you gotta give me a time limit because I'll just like go on and on. Because when you're passionate about something, you just can talk all day about it. And
Yes.
Do we have any more questions from our viewers?
Yeah. Well, I think somebody was asking about it's when we were talking about the water pick.
Yes.
Are you putting a solution in there? Somebody was asking about maybe some bleach and water. Patty says, do you use anything in Waterpik like bleach solution?
Okay. I personally don't use the bleach because it is a chemical, but I have heard that it does work very well. Um, because as a holistic practitioner, I don't recommend bleach. I see Deanne saying Therasol. Yes, Therasol I do agree with also is very good. That's also through Oratech, which has the microscopes. But the bleach, I know it kind of can work, but to be more helpful, I recommend patients can put a little bit of peroxide in their water. The reason being is peroxide has an extra molecule of oxygen. These gram-negative bacteria do not like oxygen. The only caveat is, and again, now people are going to look at me and think I'm a real wacko, but it really depends on how you believe. If a patient has a lot of amalgams, which really are mercury fillings because they are 50% mercury, if they have a lot of mercury fillings, you really shouldn't be using peroxide in the mouth because that will cause the mercury to leach. All right, because anytime you chew, anytime you're having anything very, very hot, that mercury is leaching into the system. And some people are non-excretors and they can actually accumulate the mercury into their body. And it can cause mercury toxicity and a lot of, but that's not the topic for today. That's, something else. So
That's tomorrow.
like peroxide. Oh, tomorrow. No, I do like
from the hospital.
yeah, and I'll be going to my smartphone. I do like the use of the peroxide because of the extra molecule of oxygen. We all see how well it works. So that and the Waterpik, and I also mentioned earlier the use of melaleuca and oregano oil. Like if you have if a patient has a regular, canister Waterpik, not the handheld one, you've had them fill it with the water and then have them 2 drops of the melaleuca, 2 drops of the oregano oil. Like I said earlier, some may have missed it. The melaleuca breaks down the fatty lipid layer of the bacterium, and the oregano oil will actually kill it. The oregano is a natural antibiotic. So if you have those patients who have just like that gingiva, it just looks like brown, round. It's like erythrodermatitis and just like, oh, it's so spongy and all that. Have them, after you do your root planing stuff, try maybe using the melaleuca, the oregano oil. Other than peroxide, that's the only thing I recommend in the Waterpik. But sometimes the Waterpik in and of itself works. If you don't have really deep pockets, and make sure you show them how to use it correctly, please. I want to make sure that the tip is being used correctly. Don't just tell the patient to use a Waterpik. Make sure they're holding it in between the teeth and they're going back and forth, left to right or front to back. And I know you all know how to do that because I can't tell you how many patients I get in my chair and they are using oh yeah, I'm using my Waterpik, but it doesn't look like they're using the Waterpik. And I say, well, did anybody ever show you? Well, no, I'm just using it. And I'm like, so, okay, I have to show them. So make sure they are using it correctly. So any of these medicaments I'm telling you, it's not going to work if they're not using it right. So.
Fran, do you use chlorhexidine or do you have
No.
What's your alternative to that?
We use something called Triology. The chlorhexidine, as we all know, prevents fibrin. So it does not really help afterwards. We use Triology, which is awesome. It's awesome. Hi, Aisha. It's Triology. Triology is actually it's almond oil based, and the studies are showing that Triology is far superior to chlorhexidine. And you're not going to get the staining. You're not going to get the supragingival calculus. You're not going to get the altered taste. Your patients, the tissue will get healthy, and they will not have all those awful side effects. And it's great for when your perio patients in scaling root planing, post scaling root planing. We do things a little differently when we do our scaling root planings. We use a lot of ozone. We use ozonated medical grade ozone water. We use ozone gas. Ozone gas kills all of those spirochetes and amoeba and all that stuff. So we do a lot of other fancy things.
Yeah, you guys are fancy.
Yeah. I see Carry Free. Yeah, Carry Free. I think that actually has the Carry Free. Doesn't that have the bleach? Has the I can't think of the name of it. because I've been away from chemicals so long. The bleach, it has like a bleach base to it, the carry free. So I know
think
I know it works, but I don't know enough about it that I feel comfortable saying yay or nay.
So, Fran, for some people that might be interested in incorporating this type of technology into their practice, what would be some steps that they can take to either explore more? I know we mentioned some websites previously, so would you recommend starting there, or what's the resource, to get trained in all these different types of bacteria, or to get the technology?
Yeah, unfortunately, there's not too many places to get training. I mean, we're all conventionally trained, and then it's a conscious choice that we make to do this. A lot of stuff I learn is I self-fund my visits to the IAUMT. I self-fund my membership to them. I learned a lot through them. There's not that many courses for hygienists there, but that's why I'm starting there, because I want to change that. I believe, and I actually spoke to the director when I was there in Vegas in September. I said, I really feel very strongly that you need more hygienists on board to be able to understand the validity of these protocols, and that we really need to have programs for these hygienists. That's why they gave me a green light. They want me to speak, because they want to give it a test. I spoke to so many doctors there. They say, I want to bring my staff, but there's nothing here for my staff. There's a lot of great courses for the doctors, which I sit in on, and a lot of them I get, and some of them are they're like so far over my head. I'm just like, yeah, I'm not getting this stuff. So we really need to be able to have more courses for hygienists. So you can start with the IAUMT. At some point, they're going to be having more courses, I'm hoping, if I have anything to do about it. Also, the IABDM, the International Academy of Biological Dentistry and Medicine. The president of that is Dr. Dawn. Oh my God, her last name escapes me. Ewing, Dr. Dawn Ewing. She, of all people, could be extremely helpful, because she was originally a hygienist. She was an RDH, and then she went on to become a naturopath. So she now practices as a naturopathic doctor. But she started, as one of us. Mm-hmm. And she found how helpful it was using these protocols. So Dawn Ewing at the International Academy of Biological Dentistry and Medicine, you can find out stuff there. Also, the HDA is good, but it doesn't really have anything for the hygienist. That's the only thing. So they do have some homeopathy courses you can take, which I've taken. They do have one course on Perio every so often on how to do, biological Perio, the microscope and the scaling with planing, the ozone and stuff. But there's no actual learning course. So that's why I created my company, so that way I could assist hygienists in incorporating minimally at least the Perio protocols into the practice. The doctor didn't want to go fully biological. But again, it's on hold right now because of my little health hiccup. So
yeah.
But again, I found the cause. So exactly. I'm embracing the hiccup because it's a minor hiccup I can fix. Oh, we lost Katrina. Oh, there she is.
Oh, there she
is. My phone was telling me I had 25%. I'm having technical difficulties tonight.
Yeah.
All right. So, Fran, do you have any speaking engagements coming up, or you're just waiting for right now?
Well, right now I have one, like I said, in Denver in March. I did want to go to Smiles at Sea in March because I spoke in Cancun. Elijah approached me and said if I wanted to speak in March, and I would love to do it. But that one is from the 15th to the 19th of March, and then I have to fly out. So then I have to go to it's Cozumel, and then I have to fly out to Denver on the 21st. So I'm home 2 days, a day and a half, which for this old broad, that's too much for me. So sorry, it was too close. If it was a couple weeks apart, it would have been fine. So I am waiting for the one in March. And like I said, I did have somebody else approach me. So I'm waiting on, I'm supposed to connect with her very shortly and I don't want to say who it is or what her company is. So But so those are the speaking engagement I have right now. I'm actually not, if some of them come around, that's great, but I'm not actively looking for them again, and just want to get myself healthy first.
Mm-hmm.
Yeah, but I'm actually looking forward to the one in Denver with the IAUMT, because again, I want to change the the way they operate, as far as they have such amazing information for people, but they need to include the auxiliaries. We need to include the hygienist, because it's a powerhouse of the practice. The hygiene is the powerhouse of that practice, because a lot of the restorative, the operative, everything comes out of that room. The patients connect with you. I mean, you see the patients more than the doctor sometimes. Sometimes they come in for the recalls. Yes, Doug, you can. Doug says, "Can I be your speaking agent?" Absolutely, Doug. Absolutely. So, it's we need to empower the auxiliaries to be able to have a voice in getting people healthy, and making decisions in the office. So that's why I'm hoping to change the paradigm of how the IAMT is not just addressing doctors, but also the whole team. So,
Well, I know I will definitely be following you, because I
oh,
think what you're doing is amazing, and I love knowing that you really are making a difference in the lives of these patients. And I want to be more like Fran.
no. Well,
Hashtag, I want to be more like Fran.
oh my God! Now you're making this old woman blush. Now stop it. No, again, it's only because I found what I love. Is once you find what you love, like Sarah, you love pediatrics, you love kids, and you love doing all these things. You love the graphics and all that stuff. You find what you love. You're not working, are you? When you do that stuff, you're not
Mm-hmm.
working. It's fun. For me, what I do is fun. You know.
Fran, do
So
you have a Facebook page? I mean, other than your personal, do you have a Facebook page, like a
yes, I
professional one?
do, but it's not live. I
Okay.
probably should make it live now. It's Integrative Perio Solutions. I'm gonna do
Okay.
that when we stop here. I'm gonna make it. To be honest with you, I was holding back on it because I wasn't sure what I was doing with the office I was in, whether I was gonna do the quality control. Yes, no, yes, no. But yes, I did it. But you know what? I'm gonna make it live. So it's Integrative Perio Solutions, and I have no content on there now. So unfortunately, but you can contact me through there if need be, and I will be getting content up on there. I'm sure I'm going into surgery tomorrow. I'll be home on Friday. I'm sure I'll be, I won't be able to talk, but I'm sure my fingers will be fine. So I'll be putting some content on the site, on the page rather, you know, at
Okay.
that time. So I held myself
Okay.
back.
Because
Jamie is going to scream at me anyway.
well, you're
But
doing the right thing now, and I'm so thankful that you've chosen to share your story with us, the personal side, the professional side, and all the challenges or hiccups, as you say, that you faced, and look where you are now. I mean, you have done so many things, and just since I have met you over the summer, and I'm just very proud of you, and I'm happy to call you my friend. So thank
same
you.
here.
Thank you
Sarah,
for being our first interview.
thank you,
Yeah.
Sarah. You too, Katrina. I mean, watching you grow too. Oh, go ahead.
Well, yes. Thank you so much, Fran. This is awesome. The best first interview.
Oh, no. You guys are awesome. Thank you so much. You're making me blush. I'm so humbled to be asked. I really appreciate it. Thank you so much.
Of course. So I think we're going to try and post some links and some stuff that Fran shared with us. So if you guys are interested in looking further, hopefully that will give you guys a start. Yep. Yeah.
Oh, we lost Sarah.
Did we lose her?
It looks like
Oh.
we lost Sarah because she's frozen in time.
Uh-oh. All right. Well, I guess we will. Should we end it without Sarah? I don't know if she can get back on.
I don't know.
This is what comes with live
Well, and you know what? And
interview.
that's okay because that's what makes it real. I love when
Yeah.
it's real instead of rehearsed and well, like everybody's like this. That's good.
Yeah. Well, I guess we'll cut it off, but thank you so much, Fran. I can't wait to follow you and see what you're doing. Thank you for being an awesome first interview, and we will be thinking about you and praying for you, and we'll talk to you soon.
All right, great. Thank you so
All right.
much. God bless.
Thanks.
Thank you.
Bye.